Hello, everyone. Welcome again to another edition of Lupus Talks. I'm Ed Peterson, one of the directors here, program directors of this podcast. But I wanted to let you guys know today is Tuesday, June the 2nd, as we were talking about the month of Lupus Awareness Month in May. But we're going to carry that all the way throughout the rest of this year. We're not stopping just because it's just a 1 month thing. We're talking about impacting and empowering our communities, awareness of lupus, those who are suffering from lupus, and also those who have been misdiagnosed and didn't know they had lupus. Those are some things that we're going to be talking about. There's a lot of other topics that's going to be on the plate throughout the rest of this year as we continue the growth series of Lupus Talks and awareness, and just kind of giving you some education, reference to that, some insights of what Dr. Kavina Williams and Mr. Lois Olson will be talking about, healthy tips on what to eat, also medications. It's expensive. We got to have advocates to help people cover their costs on the meds. And also, too, we're going to be sharing some things. You always can go to our website at lupusofnevada.org, fill out the form, and of course, we'll be happy to address any comments or concerns that you may have during this podcast. So, with that being said, Dr. Williams, take it away.
Hi, thank you, Ed, and I appreciate you. Hi, Dolores, how are you?
I am doing good. How are you doing?
I'm doing fine. I welcome the lupus community and the families and friends. And we're going to be talking about two things. One is going to be, again, lupus and caregiving. My cousin is a caregiver, and I think that's very important. I want to let you know the information that we put together is from the Lupus Foundation of America, and we don't own any copyrights of that. The materials we give you is educational purposes and support purposes and advocacy. So let's go into it. We all know lupus is an autoimmune disease that attacks every vital organ in your body. 1.5 million people have lupus, and it's gone up to 2 million, I should say. The facts about lupus is fatigue, headaches, painful swelling, joints, muscle pain, fever, anxiety, anorexia, weight loss, anemic, mouth sores, fingers turning white, abnormal blood clotting, alopecia, UV light sensitivity, skin rashes, pain in chest, swelling in feet. Those are basically the facts about what we encounter every day. I thought something was very important with the caregiving, and Dolores can probably answer that. When we talk about caregiving, the foundation had specific information about the person with lupus includes, they have a personal book out, manual, and it says personal information such as date, birth, identification, insurance information should be in a packet for the caregiver. All current diagnosis and medication history should be in the packet. Contact information for all doctors and other healthcare providers should be in the packet. Dates of doctor visits and changes in treatment should be in the caregiver's package. Names of medications, doses, and special precautions and emergency contacts. I think that's very well put. As you caregive, as a caregiver, do you agree with those, or do you have that information for your people, like for your mother?
Absolutely, absolutely. That's very important because you're just like being the nurse. It's just like a nurse's duty,
Mm-hmm. Mm-hmm.
and you gotta make the recording of everything because you go into the appointments. Like I have field job. That's my field work. It's appointments or shopping. Those are field jobs.
Mm-hmm.
And that is so definitely, especially, yes, I urge everybody to make sure that they have it in a place where they can get it. If there's an extreme emergency, you will know their medical history and all that to give to them.
Mm-hmm.
Because if anything happens, you're reliable of that stuff.
Well, we have, when creating a file that you have, it also says inform, provide access to essential information as a caregiver, help communicate between your loved one and their providers, and doctors are caregivers too. Unify all important information in one place. That's important, so it's not, in other places. Reduce stress, knowing that all health and emergency information related to care recipient is organized into a place, and save time, save energy. When the caregiver is unavailable, a well-maintained file can help others provide proper care for all the persons that are ill. So you have one and the patient has one. I think that's very important that they have that. Being a caregiver, do you ever get attached to the patient?
Oh yeah, yeah, and because you're close to the person, you know, it can become a attachment because you can
Mm-hmm.
become either,
Mm-hmm.
if you're dealing with family or not family, that person could click like family to you
Yeah.
because you're caring for the person.
Yeah.
So I said, "Oh, this is like my second." It could be somebody younger than you. This is my second daughter. This is
Mm-hmm.
my,
Mm-hmm. Mm-hmm.
or somebody could be older. Oh, this is like a mama. You figure to me or something. And so there is a different connections because I heard of other parties that had connections like that, and it was sad when they passed away.
Mm-hmm.
And it really took it hard because they been into the field for more than 5 years with the
Oh
patient with
yeah.
the client.
Yeah. Your sister, our cousin who passed away, was a caregiver for 12 years, wasn't she? A long time.
She was a caregiver back in the days until she couldn't perform it anymore,
Mm-hmm.
at that time. But she was on there, and then I also, I was side by side because we worked together. She had one shift and I had one shift. And
Mm-hmm. Mm-hmm.
that so her past, yeah, back in the days was caregiving also.
When caregiving someone with lupus, and I'll say me, because you caregive me for a long time, was I a difficult patient?
Well, I just say that
Be truthful.
I just say that I know that you had some hard times because it was due to the lupus, so it was quite understandable. Sometimes I know that you really was
Struggle.
heavy because you didn't feel good. It's the but actually after you felt good, cause actually it was all right. It's just
Mm-hmm.
what it was
Mm-hmm.
just days when you was down and not feeling well. That's
Mm-hmm.
just the days that you had your ups and downs. So I just say consider
Mm-hmm.
it as ups and downs as struggles. That's all.
The days that the caregiver showed up, and not caregiver, the therapist showed up, and it was a freshly new surgery, excuse me, on my knee, and I didn't want to exercise. I didn't want them to push me to the limits, but you were there as a caregiver giving me that support. You can do it. You can do it. Walking around the cul-de-sac. So that's very
Yeah.
important that your caregiver is there with your therapist so they can offer the compassionate love, because just because the therapist comes in, the 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 patient is more close to the caregiver than the actual therapist that comes in to give you your exercises and what you need to get well. Because they're more harsh than anything. They can say, get up, you can do it, you can do it, you can do it. And they don't know the pain that you suffer and are not aware, but you were always there saying, okay, you let them know she's not feeling well. And if she says she can't do it, just push her a little bit, not too much. And I appreciate that, what you did, because it gave them an insight that they can't push everyone the same way they push those of us who have autoimmune diseases. So I appreciate that because I felt helpless and uncertain about what was going to happen. The stitches in my knees, were they going to, when I had the knee replacement, was it going to open up because it was so tight? When do I have to go back and get the stitches out? Are they going to have to redo some surgery on me? Just like now, the knee was hurting and it stopped hurting because they said every 7 to 8 years you have to go get a new knee replacement. Well, I'm taking care of mine, so I won't have to do that because that was excruciating what I went through. plus the pain. And I'm not one to take all that medication that for pain they give you, because I'm already on 28 pills, not mind blowing pills, pills for your liver, your kidney, your immune system, your organs in your body. So, and that's enough for me. So, what is
Yeah,
your, huh?
yeah, yeah. I remember that time. I remember that time, but that I had to do my job as being a caregiver because they said that you had to do those. Because I kept on reminding you, I said, "Cause if you don't do that, you're gonna have more problems. You're gonna be stiff."
Mm-hmm. Yeah.
And so, but you did it. You went out
Yeah,
there and
because
did
you
it.
can be stiff. And when you become stiff,
Uh-huh.
it's very hard to work those muscles because now they're stiff. They're satisfied in being in one place because they're hard. They're harder to move. If I'm correct, right?
Yeah, I'm gonna tell you some stories. If I would have probably did right with mine, I think I probably wouldn't have had as much problems. It took me 2 years to get back to a normal walking. It was cricket, my foot, and I think mainly most of it was lack of not doing too much of that exercise. And I praise God now it's back straight again. But it
Mm-hmm.
was cricket, and I was walking with a limp.
Mm.
After I had those screws in my left foot. It was a freak accident that happened. I had no idea what happened.
Mm.
All I know
Mm.
that I was limping and then I couldn't walk. I went into emergency. They said fracture. You fracture and it's breaking. Three of my bones was breaking. They said if I wouldn't have got that surgery, I went to the sports medicine up in Nevada. They did a very good job in Las Vegas,
Mm-hmm.
Nevada.
Mm-hmm.
Excellent job. I got released on that day. I remember that.
Oh
After
yeah.
surgery, got released and that, but it took me so far so good for all those years. I have not had to have it tighten up, and some people have to have it tighten up. I didn't have to have it tighten up.
Mm-hmm. Mm-hmm. Because
It's
that's
not
the way you
bothering
took
me.
care of it.
Yeah, because I did take care of it like that, but it's just because he did warn me that it can possibility happen. Some people it depends on the person, but
Mm-hmm.
I just said to everybody, please do your exercises because,
Yeah.
like I told
Yeah.
you, I think if I would have pushed myself more, I know I was a lot heavier set than I am now today. If I would have just pushed myself more like that, it would have been a lot better
Mm-hmm. Well,
because
I want to let the audience know out there that a caregiver defined, if you provide direct care and support to a person with lupus, and you're likely a caregiver, regardless of your relationship to the person with lupus. Now, I know you're my caregiver. When I get on the phone, say I'm having problems with this, you can be a caregiver in a distance away, in
yep,
another
yes, you
state,
can.
as
Hmm.
you giving me some insights. Why don't you do this? Why don't you do that? That's important because it says, what is a lupus caregiver? A lupus caregiver is someone who commits to providing direct care and support to a person diagnosed with lupus. And you are doing that as of right now, long distance. And it says, who are lupus caregivers? Their caregivers may be parents, spouses, children, and other family members or friends. In some cases, there may be more than one caregiver. And that is really, really important because they said because each lupus diagnosis is so unique, care needs and caregiving responsibilities may vary. We're not the same. We're not the same. There's some people that can be so difficult to work with. What happens when, if I give a scenario, if someone is so difficult to work with, they have lupus, um, how do you feel them out? How do you uh, get their mindset in a way that they accept your help?
Just really be patient. Number one, be patient, and just realizing how the consideration how they feel. Be sensitive. You have to be sensitive to people's feelings and stuff. So you just until you gotta really talk to them. Really talk to them and get them to open up. And the more they open up, the more they can. They'll
Mm-hmm.
tell you how they feel, and more they then that way you're building up trust with them. Because you got to build that relationship too. Number three, you got to build the
Hmm.
relationship with the person.
Well, believe it or not, as we get older, we all are going to have caregivers. And like I have a caregiver now.
Mhm.
You long distance, my son, my brother. People that care enough to. My brother will check in on me every morning. Now knock at the door and say, "Are you all right?" I say, "Yes, I am. I'm doing fine." And that's caregiving. Something happens, he's able to, make a call or help me with whatever's going on. Like I couldn't get up out of the bed a couple of months ago, or I couldn't move my left arm, and I was
Yes, I
telling you I couldn't
remember
move my
that.
left arm, and it was excruciating. I had to put ointment, and they sent me to therapy, which was acupuncture, which was excellent. I let people know acupuncture worked well for me, and that's something we all should consider as an alternative. I'm not telling you what to do. As a disclaimer, I can't tell you what to do, but I know it helped me, and the pain's still there, lightweight, but it's much better than it had been. Much better. So the caregiver's role is so important, so vital. They're human. You guys are human too. You guys have feelings too. Um, you take extra care of the individuals that you work with, and you get to know who they are, and the hurts, the ands, the ifs, the what ifs, the pains in their bodies. Like you feel the pain yourself. Do you agree? It feels like you feel it.
Yes, I totally agree with it. Yes.
Yeah, that you're right there and you know where it hurts. You can pinpoint it right there. What would you say to the people out there who are attempting to get caregivers? What advice would you give them?
Make sure number one that you have a real good person, a real good caring provider for you that understands your needs, that understands if you're gonna have a breakdown, because some of them have breakdowns. You got to be patient with the person. Somebody that understands that will be patient with you and not impatient with you.
Mm-hmm. Mm-hmm.
That's very, very important. And
Mm-hmm.
two, also you want one too that make sure they're a good reporter. When I meet by a reporter, they're writing down things that if you're going through anything that needs to be addressed to your doctor, because some of them may need somebody to write for them because they're having
Mm-hmm.
trouble writing. Sometimes it's hard for them to write
Mm-hmm.
things.
Mm-hmm.
And so you got to really be a good listener too. And a good listener is very
Mm-hmm.
important.
Is it important to be in charge of their medication?
Yes. If it's required, if it's required medication, yes. If they cannot take it on their own and they have to have somebody else to do it
Mm-hmm. Mm-hmm.
like that, then that's your job, and you make sure that you write in the time. So let's say if it's 6 o'clock, 6 o'clock a.m. was their time, right? And let's say they had like a 12 hour, maybe it's every 12 hours they had to take it like that, then you have to just really pay attention to
Mm-hmm.
that timing of how many 12 hours. So the next 12 hours they take it their next dose, and you never give them a dose in between.
Mm-hmm.
That
Mm-hmm.
could put them at risk.
How would you uh, go about getting a caregiver? Do they have to go through an agency? The people that have lupus or autoimmune diseases, if they listen to this broadcast and want a caregiver, um, what would you tell them?
That's a good question. They could go through an agency that has like in-home supportive systems. It depends. In each state they have a different name. I know in California it's in-home supported services. So which is IHSS. That's what they call it. But other states they call it different. So you just have to really find one that's compatible with the insurance that you have. Because some of
Does the
them you will
doctor
have
have
to
to
pay.
refer it? Sorry, I couldn't hear
Ye-
you.
Doctors, now doctors, you know what? In this, yep, they do, because some of are going to ask you, because there's a social worker behind it.
Mm-hmm.
They're going to ask you, uh, what's your uh, what's your doctor status? Blah blah blah.
Mm-hmm.
You know, they want to
Get
know because
approval.
they can't get approval. They can't just say, oh, I'm going to approve you right now. You have to have everything on paperwork, and it has to go
Yeah.
through your doctor.
Yes, yes. That's why we go in there and the doctor asks, how are we doing? Do you need extra help? You know, they do that. Do you need any help? How are you feeling today? Or do you have difficulty um, doing house chores, washing, you know, washing dishes, getting in and out of bed, your medication? That's why they ask those questions because it fills us out as to what our needs, you know, for a case, you know, for a caregiver to come in. Is that correct?
Yep, that's correct. That's correct. That's exactly what they do.
Mm-hmm. Mm-hmm. I know there's a lot of people out there thinking about caregiving, and don't be frightened about it. If your body needs help, and you can't help yourself, it's always good to reach out and ask someone to help you. It's always good to ask for help. You're not being weak by not asking for help. You know, you once could do this, could do that. Now you have an autoimmune disease and you need help, and there are a lot of caregivers and people out there that will help you get on your feet and help you along the way. You have
Yeah,
any?
rely on your blessings, you know, 'cause that's a
Mm-hmm,
blessing to have caregivers. Don't try to do it on your own because it's going to attack you more on your
mm-hmm,
system because your body can't take it.
mm-hmm,
Don't feel say, oh yeah, yeah, I'm feeling weak or something like that because I asked for help. No, it's nothing wrong with asking for help. It's okay to be not okay in a good way, you know.
mm-hmm,
When you're not okay, go get help. Go get
mm-hmm.
help that you need. Let somebody do that blessing for you.
It's not just for the elderly; it's for the young ones too that need help
Yep,
if they have lupus and other diseases, huh?
yep. It's not just for the elders. There's people about my age, 53. You know, I'll be 53 in a couple weeks.
Well,
You
happy
know,
birthday.
yeah. Thank you. And you know, and so for me being 50, going on 53, you know, they have people in 53. They have people 40 something. They have people in some in the 30s. Some in it was in the 20s.
Mm-hmm,
You
mm-hmm.
know, we just don't know. Our bodies is no, it's no age. It's no age on it. It depends how we're taking care of ourselves or our conditions. It could be inherited things. We don't know. It just comes. It just comes.
Now, does the
But once it,
caregiver? I'm trying to listen to you because it's real low. You guys, your voices are real low on my phone. I don't know what's wrong with my phone. Um, does the caregiver clean up your house, feed your pet? Is there a certain caregiver that can do that, or just watch the patient?
all they are required to do is what the client is to do. But if the client, if they said, because according to some of the reportings, how they reported, they said cleaning. This is how many hours for cleaning. This is how many hours for feeding, and then after that, doing the dishes and stuff, doing the laundry, and then there's shopping, and there's also appointments. And so, if it's a pet or something like that, no, they really don't have to do that. That would be family's responsibility.
Oh, okay.
But if you want to do it for your heart for them, you can do it out of
Mm-hmm.
your heart, but you're not getting paid. You can't mark it down.
Mm-hmm.
If it
Mm-hmm.
doesn't say on that form, you can't mark it down.
Wow, wow. It's a lot to be a caregiver, and a lot of rules and regulations and things you do, you don't. Do you guys have to fill out forms, and do they evaluate you as a caregiver from the agency?
Oh yeah, they have evaluations. It depends on the company. And once a year thing, they have evaluations to make sure the client is still eligible. And then nowadays it used to be paperwork, everything's electronic. But the only thing they give you on paperwork is how they calculate it
Mm-hmm.
for the hours, how they calculate, and they give you a list. Hey, this is for this, and they put a check mark. So if there's a check mark there, that's your work that you're supposed to do. That
Does
you're
the
gonna get.
patient, does the patient, I know, I'm sorry, cut in because it's my volume is so low. Does the patient chime in on that review? Do they ask the patient questions as well?
Uh, yes, every agency is different. There's one that operates by phone system, and they'll say your provider, blah blah blah, has these many hours,
Mm,
like that. Do you approve of it? And they could
okay.
decline it if you're not doing your work. They could decline it.
Wow.
Uh huh.
Wow.
Yeah, they could push in there and say, "Yep, they didn't do the work."
Mm, wow. That's
Yeah, and then some that still go by paperwork, but according to California, a lot of the paperwork is leaving. Everything's computer like
mm-hmm.
that because the fact, just like what they have no more plastic bags out here. They don't use plastic bag. Everything's paper now. So you gotta
Do they
buy
come in?
recyclable bags.
Do they come in and do an on-site evaluation?
Yeah, they can. They do it like a once a year thing. They go in there, they check things, but it depends on the state. Every state is different.
Yes. Yes.
They have different regulations. Some of them may come in more often than you think, but it just depends on if there's a complaint, they will walk in anytime.
Hmm.
They come knock on your door if they're suspecting anything. Yeah, they'll knock on your door and say, "Can I come in?" So
And they got to make sure that person's still living because I know there's a lot of false
uh-huh.
reporting. Say
Yep.
a patient dies and they keep filling out that paperwork that, they're doing fine, they're doing fine. I don't know. I'm just saying there's a
Yep.
lot of fraud
Fraud
with that.
activity. That's fraud activity, which could be put in prison if you do
Wow.
that.
Okay. Okay.
Hmm.
Wow. You love your job, caregiving, your
Oh yes.
profession.
Uh-huh.
Okay.
I make sure I go everything by the rules.
Okay. Okay. Wow. So it's good to know that people like you are out there, and I know that person as she's my cousin, and caregiving is what she likes to do, helping others. So you couldn't pick a better person than Dolores to take for you to take care of us. Now you'll probably get a bunch of calls, and people will ask you, "Could you come and take care of me?"
That's when I have to have extra arms like an octopus.
Yeah, yeah, you are. You are. Yeah, you become caregiver of the year. They should have that caregiver of the year. Well, I'm so appreciative
Yeah.
of going over the do's, the don'ts, the list, the essential things that the patient needs, and you are able to answer that, and you're able to, give us ideas in terms of where you stand with the patient and where the patient stands with you, and that's so important because they are the mouthpiece of what they want. If they don't speak, then we can't help them. So, Ed, are you there? I see your picture. I don't know if you're going to tell us this about ending.
Yep,
It's,
I'm here.
Dolores, did you have anything else to say?
No, that closes the case.
Okay.
Well, this
Thank
was a
you.
great topic, ladies. I really um, got a chance to listen to it with you while I'm multitasking, as I say. But yeah, but so yeah, we're going to continue this, ladies and gentlemen. Thank you all for tuning in for this edition. You can always again go to our website at lupusofnevada.org. Also the Facebook page, Lupus of Nevada, as well as the YouTube channel, Lupus
Yes.
of Nevada. And on the YouTube channel, you'll be seeing a lot of these podcast episodes that we're going to be posting up there on a regular weekly basis. So anything that you may have missed, you can always go back there and check it out on the YouTube channel. It's going to be youtube.com/lupus of Nevada. With that, Dr. Williams, thank you for sharing. Thank you, Mr.
Thank you.
Lois. I'll call the dynamic
Well,
duo of lupus so they can continue to educate and uplift and share with information that's going to be relevant for you all to continue to learn and grow, and also kind of edify yourselves and have fun. Get a chance to get out and enjoy. It's not always going to be tight knit things that we do all the time, but we need to loosen up a little bit. Even though what's going on in this economy and country, we got to learn to loosen up and have some fun in the interim of all of this. So, any last words, Dr. Williams, you want to share?
I thank the audience for listening, and I hope this topic was very helpful. I know it's helpful for me because you never know what can happen on a day-to-day basis. So I appreciate the audience to give feedback so we know what to do, so we can give them more topics like this.
Yes, ma'am.
And I thank God for it.
Yes, thank God for this too as opportunity. Mr. Lois, any last final words?
Yeah, keep being a blessing to others, by helping out somebody in need or anything. Ask them, can I help you out with groceries, anything, or
Yeah.
anything, people, even if you find somebody elderly out there and you see they're struggling to put their groceries in the car, I say, hey, ma'am, can I help you put your groceries in the car?
Yeah.
You
Yeah.
know,
And it's all
give
about
a helping hand.
servanthood. Yeah, it's all about servanthood, and basically being a good steward of that. And servant leaders, that's what we are. Our goal is to serve the general public in any which way we can, in a reference to that, so that way they can let them know that, hey, there's somebody that's here to help you out, no matter where you are. And so that's a blessing. That's a good thing. We need to continue that there. So we're going to leave it there. Ladies and gentlemen, you guys can tune in again next week. We'll be back on as we continue the month of June. Now, we're still doing lupus awareness and all of that throughout, again, the rest of the year. We're not just focused on just May, but throughout the rest of the year as we carry on Lupus Talks. So with that, you guys have a great afternoon, evening. Until next week, be blessed.
Thank you.
Thank you.
Bye.